Good evening. Welcome to Friday Reading Live. My name is Vandana PS, one of the reading trainers from 𝐻𝐿 Academy. As usual, I'll give you a sample question from part B. Then we will discuss part A in detail today. I'll give you a few minutes to do this question. 2 minutes for the completion of this question. Here comes the question. So once again, good evening. Yes, Ellen, Monita, good evening. So here we have a question like always. And this is a policy, right? Already mentioned in the question. This comes under the second category, and which is a policy. So I'll read the question, then we will discuss the answers. Hi Divi, good evening. The policy informs us that doctors treating athletes at sporting events in the UK. Alright, so my keywords. So definitely, as you know, when you read a question, we should underline the keywords. Keywords mark because those keywords will help you to find out your answer, right? So policy, already we know that it's very clearly mentioned in the question, so I'm not marking the word policy. Instead of that, I'm marking doctors. Okay, അതിന് പകരം I'm marking doctors, then athletes and UK. Okay, a country is mentioned, UK. And these are the keywords from the question. So I'm going to understand the question in a way that, okay, which category of question is this? The other category. Hi Neetu, good evening. Yes, the category of question, as I already mentioned, this is from the second category. Okay, so second category we have manual as well as policies. Okay, and it is from the second one, which is a policy. So what is a policy? Let me know in the comment box what is a policy. എന്താണ് policy എന്ന് നിങ്ങൾക്ക് അറിയാവോ? So what is a policy? Yeah, so what is a policy? Yes, Ellen, category 2. Yes, Monida, it is a policy. Yeah, why it is a policy? And my question is, what is a policy, or what are policies? എന്താണ് policies? Or what is the difference between a guideline and a policy? ഒരു ഗൈഡ് ലൈനും പോളിസിയും തമ്മിലുള്ള ഡിഫറൻസ് എന്താണ്, അല്ലെങ്കിൽ വാട്ട് ആർ പോളിസീസ്? ഹായ് വിനീത്, ഗുഡ് ഈവനിങ്. സോ വാട്ട് ഈസ് എ പോളിസി, വിനീത്? ഡു യു റിമെമ്പർ? Only one particular rule. For example, if the rule is about, it's not related to the hospital regulations or the hospital guidelines, that is guideline, which means set of rules and regulations from an institution, a particular institution, that is called guideline. Whereas a policy is connected to the government. So here, the policy, it is from the government. Which government? UK government. Okay, so I'll read the paragraph as well as the options and we will find out the answer. So what is option A? Must be appropriately licensed. So my keywords, must, then licensed. A very short option, so I'm just marking 2 words from the options. From the option, so must and licensed. From option B, are expected to have adequate training. So my keywords, expected, adequate training. And from option C, cannot treat anyone from another country. So cannot. See, the word cannot, which signs or which indicates that you can't do it. നമുക്കത് ചെയ്യാൻ പറ്റില്ല. It's not possible for you. Or it's not possible for the country. It's not possible for the doctor. That is means cannot. Okay, പറ്റില്ല എന്നുള്ള മീനിങ് തന്നെയാണ്. Cannot, you cannot do it. So cannot treat anyone from another country. So my keywords, cannot, anyone, another. Alright, and now I'm gonna read the options. So what is the method we are doing here? In part B, we have a method called what? Elimination method. നമുക്ക് elimination method ആണ് we are applying in part B. Also you can apply skimming and scanning method here, but still the proper method we are following, which is elimination method, right? Yes. Okay, so how can we eliminate? And as I already told you, I don't know whether you guys remember that, we have 3 options. One option will be for sure it is the correct answer, or option എന്തായാലും correct answer ആണെന്ന് നമുക്കറിയാം. And in remaining 2 options, one will be not mentioned and one will be opposite option or contradictory option. So here, which one is opposite or which one is contradictory, or you can say both are contradictory or not, both are not mentioned. So what is the correct answer? Yes, hi Bhavna, Bhavya, good evening. Only one particular rule. Yes, Ellen, principle, act, etc. Last line is important. Okay. Is that last line important, Vineet? If it is from the second category, which lines are important? Not last lines. Actually, third category, last lines are important. Okay. If it is second category, the first 3 lines are important. Yes. Maybe you can eliminate some of the options from the first 3 lines, or you will get the answer from the first 3 lines. All right. Related to the government, set of rules and regulations according to the government. Very good. Yes, Nimi. Hi, good evening, Nimi. So coming to the paragraph, doctors working at sports events in UK, and they have not mentioned in the title doctors from where, which country. Okay, ഇത്രേ പറയുന്നുള്ളൂ, doctors working at sport events in the UK. Okay. Each year, athletes from all over the world, see, it's not from UK, all over the world. Who? Athletes. Come to the UK to take part in sports events and may bring their own doctors with them. So it is very clear, they've very clearly mentioned here, athletes from those part of the world, I mean around the world, maybe any country, they can bring their own doctor with them. അവരുടെ ഡോക്ടർ അവർക്ക് കൂടെ കൊണ്ടുവരാം. there is a specific registration process that for doctors who are traveling to the UK with their country's teams for sports events. So here comes the policy, the rule. എന്താണ് ഇവിടുത്തെ റൂൾ? ഡോക്ടർ കൂടെ വരുന്നുണ്ടെങ്കിൽ they should follow a particular rule from the country. There is a policy. So what is it? Doctors must be registered with a license to practice medicine in the UK. Even though they are licensed doctors, if they want to practice in UK, if they want to practice and if they want to consult the patient in UK, they need a license from UK. UK license avarku venam nanu parayunnu. Okay, so from second para first line, you can trace towards which option? Option A, maybe. Okay. This includes all doctors visiting from overseas, from other countries, and from Europe on a temporary basis. So maybe the doctors are not there for a permanent visit. They are with their athletes. Athletes in the kuda vandirikkunna doctors aanu. All team doctors accompanying their teams for sporting events must hold temporary registration with a license to practice in order to be permitted to treat, diagnose and prescribe for their team. So it's again a policies mentioned in the all team doctors accompanying what? Their teams for sporting events must hold temporary registration. അപ്പോൾ ഈ പറയുന്ന registration ഇല്ലെങ്കിൽ ട്രീറ്റ് ചെയ്യാൻ പറ്റുമോ? No. That means they should be consider അല്ലെങ്കിൽ they should hold temporary registration when they have to practice in this country. Please note that this type of registration does not permit doctors to treat UK nationals. So, ഈ പറയുന്ന ഡോക്ടേഴ്സിന് they can treat people or the athletes which they already have. അവരുടെ ആൾക്കാരെ മാത്രമാണ് അവർക്ക് ട്രീറ്റ് ചെയ്യാൻ പറ്റുള്ളൂ. They can't treat UK nationals. Okay, so that is all about the paragraph. So, what is the correct answer here? So, let me know your answers please in the comment box. What is your answer? Yes, Neetu, it is option A. Yes, Vineet. Okay, Shiny. Hi, Shiny, good evening. Okay, Devi, option A. Any other answers other than option A? So, answer is option A, must be appropriately licensed. That is from second para, first line. So, how can we eliminate other options? എങ്ങനെ നമ്മൾ B and C eliminate ചെയ്യും? Are expected to have adequate training. I can eliminate option B. Why? Is it not mentioned or contradictory option? Let me know in the comment box please. All right. The effectiveness of your teaching is remarkable and alluring. Thank you, Ellen. Thank you so much. It made my day. Thank you. Anyway, so what about option B? Are expected to have adequate training. So why we are eliminating option B? Is it not mentioned in the para or it is a contradictory or opposite option? See, getting the correct answer is good. നമുക്ക് correct answer കിട്ടാന്ന് പറയുന്നത് it's a very big thing. അല്ലേ, ഒരു വലിയ കാര്യമാണ്. But still, elimination you should know. Through elimination, we should find out the correct answer. That is the procedure, because not always all the time we will get the correct answer. എപ്പോഴും നമുക്ക് അങ്ങനെ കിട്ടണം എന്നില്ല. So, this particular method will help you to find out the answer always, all the time. All right. So, option B we can say very good. Not mentioned. All right. Yes. Okay, Shruti, Divi, Vineet, it's not mentioned in the paragraph. They should have adequate training. It's not mentioned. Option C, cannot treat anyone from another country. Where is it mentioned? They cannot treat. See, it is contradictory actually, right? No. The opposite option alle. It is opposite or contradictory option. Why? They cannot treat anyone from another country nalla parayna. They cannot, does not permit doctors to treat UK nationals. UK la alkare treat cheyan pattilla ennaanu parayunnu. Okay, so again contradictory option or opposite option. So that answer is option A. When you get the correct answer, you can bubble the letter. A letter ningal bubble cheya. Okay, so that is how we are doing part B. So once again, I'll just summarize contents about part B for you. And next week you have exam, right? Anyway, so in part B we have total 6 questions. Okay, so there will be a question, there will be 3 options and a particular paragraph. You can read the para, then try to understand what is mentioned there, find out the correct answer. And we have a procedure for that, I mean a step-by-step procedure. First of all, you can read the question. question വായിക്കുക. So when you attend the exam, always remember, okay, when you get part B material, okay, first step is reading the question. So I'm going to read the question. So read the question. Second step, I'll underline the keywords. Okay, I'll underline the keywords. So what are the keywords? Maximum 3 keywords, not more than 3. And third step, what is third step? Understanding the question. If you don't understand the question, then your answer will be wrong, no doubt. Question മനസ്സിലാവാതെ എങ്ങനെയാണ് നമുക്ക് ആൻസർ കറക്റ്റ് കിട്ടുക? So no chance. So please do understand the question. When you understand the question, it is a process. എന്താണ് ആ പ്രോസസ്സ്? What is the process? Okay, which category? Already you guys know 3 categories. So which category of question? Which lines are important? What are you reading for? So likewise, you can understand, grasp an idea from the question. And the next, fourth step is read the option. Okay, in fourth step, little bit lengthy, read the option, underline the keywords from the option, read the paragraph. Okay, read the option, underline the keywords, read the paragraph. And the final step is you can go for elimination. And the important thing in part B is that when you read the paragraph along with reading, you should eliminate your answers. Otherwise, it will be confusing for you. നിങ്ങൾ വായിച്ചിട്ട് പിന്നെ പോയി eliminate ചെയ്യാം എന്ന് വിചാരിച്ചാൽ it will be very confusing and majority maybe your answer will be wrong. Okay, so what you can do is along with reading, you can eliminate. Okay, so answer is A. That's that. Yes, okay. All right, so we are moving to another self-prepared material for part A we have today, which is toxic shock syndrome. Yes, so how was the material? Actually, the previous materials, okay, the previous materials were a little bit difficult, so that I just put this material very easy. Okay, so that your colleagues or your friends, okay, those who are going to attend the exam for the first time, I mean the freshers, can find this material very helpful and easy. All right, so let's read it and find out the answers. See, whatever the material, the standard is, I can say if it is easy or if it is an average material, if it is a tough material, the procedure is the same. The understanding is the same. The words are the same. The time is the same. Everything is the same. Okay. മനസ്സിലായെന്ന് വിചാരിക്കണം. വാട്ട് എവർ ദ മെറ്റീരിയൽ, അതായത് പി സി മെറ്റീരിയൽ ആണെങ്കിലും ആവറേജ് മെറ്റീരിയൽ ആണെങ്കിലും ടഫ് മെറ്റീരിയൽ ആണെങ്കിലും നമ്മൾ ചെയ്യുന്ന കാര്യം ഇറ്റ്സ് ദ സെയിം അല്ലേ? വി ജസ്റ്റ് വോണ്ട് ടു റീഡ് ഇറ്റ്, അണ്ടർലൈൻ ദ കീവേഡ്സ്, ഫൈൻഡ് ഔട്ട് ദി ആൻസർ. ദാറ്റ് ഇസ് എ പ്രൊസീജിയർ വി ആർ ഡൂയിങ്. We are applying the same method. It is skimming and scanning. We have the same time, 15 minutes. Okay? So please do understand whatever you guys are reading. ഇപ്പോൾ ഞാൻ കുറേ പേരെന്നോട് പറയുന്നുണ്ട്, മാം പാർട്ട് ഈസ് വെരി ഡിഫിക്കൽട്ട്. ഓക്കെ, വി ആർ നോട്ട് ഏബിൾ ടു മാനേജ് ദ ടൈം. വാട്ട് വി ക്യാൻ ഡു? എന്താ ചെയ്യാൻ പറ്റുക? So I am just telling my students always, all the time, please take a part A material. And we have a lot of part A materials and also self-prepared materials for part A in this page, particular Facebook page. So you guys can take the material as well as part B also. Okay, so you can take the material, take the printout of the material, and you can read the material. Don't set the timer. Okay, so once again I'm repeating the same. If it is difficult for you, I mean part A is difficult for you, okay, at least for the 1 week. For example, today, you're starting the material today. You can take the material and don't set the timer. ആദ്യമേ തന്നെ ടൈം സെറ്റ് ചെയ്ത് ചെയ്യാൻ നമ്മളായിട്ടില്ല. So because we are freshers, okay, so we should understand the process. ആദ്യം നമ്മൾ മനസ്സിലാക്കിയെടുക്കണം എന്താണ്, what is reading, understand the technique. Okay, so take the material and just relax and read. Okay, the module is reading. So read the module, the text. Okay, then you can do what? Underline the keywords. Keywords underline ചെയ്യുക. ഏതൊക്കെയാണ് important words which you think. And we have a strategy for that, I'll tell you lately. And whatever that, yes, coming back to reading. So you can read the material, underline the keywords from the material, read the question, take your phone, Google the meaning. If you don't know what is the meaning of the word, just Google it. Okay, and take a book, write the meaning there. നിങ്ങൾ ആ meaning അവിടെ നോട്ട് ചെയ്യുക. When you write the meaning there, it is in your mind. So അടുത്ത മെറ്റീരിയൽ ചെയ്യുമ്പോൾ if that same word is appearing, okay, നമുക്ക് ഓർമ്മ വരും. We will remember, that is the meaning. So likewise, we are getting a lot of synonyms from a lot of materials. So in the first week, it's all about understanding what is reading. Okay, second week onwards, you can put the timer. എത്ര മിനിറ്റ് വെക്കണം? First of all, you can put 20 minutes. On the next day, just reduce the time. 15 minutes. Okay, for the next week. And from the third week onwards, do practice fast reading or speed reading. It's not a very simple task. So please do practice it in these 2 weeks. Adu practice here, apply it. Definitely, trust me, from the next week onwards, from the 4th week onwards, you will get 20 out of 20. Okay, so that is the process. So coming to this material, I hope it is clear. Ma'am, for part B, which method is good? QAT method or QTA method? Could you please elaborate it? Actually, I didn't get that. Question, answer, and what was that? Yeah, so whatever it is, Kamlesh, could you please elaborate it a little bit more? All right, so coming to this material, toxic syndrome. Okay, sorry, toxic shock syndrome. And I'll give you some time, at least I'll give you 2 minutes for skimming and scanning. I know already you have done this material, but still, I just want to know what are the keywords, and if you guys are ready to read and underline the material. So I'll give you 2 minutes. So please do read the material and please do comment in the comment box what are the keywords from text A, B, C and D. Just what are the important words which you think important you can comment. Okay, so please do it. I'll give you 2 minutes. And I hope you have the material with you. So please do skimming and scanning. Okay, and please do comment what are the keywords from text A, B, C and D. Alright, so I hope you have done skimming and scanning, right? Okay, so please do check whether these are your keywords. Okay, now I am and the keywords mentioned here. Okay. So toxic syndrome, TCS, is a rare but potentially life-threatening condition caused by certain strains of bacteria that produces poisons, and toxins get in your bloodstream and can affect organs such as heart, liver, kidneys. It is often associated with using tampons using menstruation. However, TCS can affect anyone of any age. Skin wounds, surgical incisions, nasal packing, scrapes, burns or other areas of injured skin can cause or increase the risk of the condition. Half of all cases are unrelated to menstruation. Toxic shock syndrome affects 1 in every 1 lakh people. TCS is more common in people as an female at birth, which is AFAB, but it can affect anyone. Until 1990s, it was most commonly associated with people using super absorbent tampons during their period. Most cases of toxic shock syndrome are caused by a toxic produced by Staphylococcus aureus or staph infection and Streptococcus pyogenes group A strep infections. Clostridium sodali can also cause toxic shock syndrome, but it is less common. Under normal circumstances, these bacteria live in your skin without causing any ill effects. When you use a tampon, Staphylococcus aureus or staph bacteria may became trapped in your vagina and enter your uterus via cervix. Bacteria may grow on tampons, especially if they are not changed often enough. Bacteria may also grow if your menstrual flow is light and you use a super absorbent tampon. Tampons can also cause tiny cuts in your vagina, and bacteria can enter your bloodstream. Toxic shock syndrome can occur when bacteria get into open wounds, cuts, or sores in your body. This can be from skin infection, surgery, childbirth, or nosebleed that requires packed gauze to stop it. Okay, so these are my keywords from text A. So let me know in the comment box, are they same? Ningalde keywords same aano? Any difference? I hope it is the same. Yes. Okay, Kamlesh, question answer text or question text answer. I'm not compelling you actually. I'm just saying my opinion, okay? From my experience, I'm saying this. In part B, I'll say, first of all, you can read the question. Okay. As I already mentioned, underline the keyword from the question. Then you can understand the question, which category of question is that. Then you can read the options first. Then you can underline the keywords from the option. Okay? Then you can go to the text, the paragraph. So question, answers or options, then the text. That method is good in part B. But in part C, from my opinion, it is the opposite. Question, paragraph, answers. I hope it is clear. Okay, you can follow. If you want, you can follow. Because it is very, otherwise it will be very tricky. That is why I'm saying this. So, yeah, it's up to you. Okay, actually I'm saying to my students is that you can do one thing, read the question first, then you can read the options, then go for the paragraph. That will be better. Okay, as well as when you read the paragraph, along with reading the para, you can eliminate your options. All right, it's clear? Yes. Then text B. Okay, so Monida, yes, it is the same. Yes, Shiny, same. Selin, Nimi, same. Text B, it's a table. So definitely one of the texts will be a pictorial of something, as you know. Table, classic criteria for clinical diagnosis of TCS: fever above 38.9 degrees Celsius, hypotension or orthostatic dizziness, diffuse or palmar erythroderma, then desquamation of hands and feet, hyperemia of conjunctiva and of the mucus, then membranes of the oropharynx or vagina, multi-system dysfunction which must include at least 4 of the following, then diarrhea, alterations, impaired renal function, impaired hepatic infection, then thrombocytopenia, then elevated muscle creatine, phosphokinase. Then cardiopulmonary dysfunction as well as decreased serum calcium and phosphates. Okay, so that's that. So these are my keywords from text B, because it's a table. Even though it's a table, each and every line is important. Okay. Text C, complications. So what are the complications because of TCS include organ damage, shock, death, amputation. Okay, so these are the complications from because of TCS. Because bullet points are very important, so please do underline the bullet points. And definitely they will ask you questions from the bullet points as well as numbers mentioned here. Yes. Then prevention. Washing hands well and often can help prevent the bacteria that cause toxic shock syndrome from spreading. During their periods, girls can reduce the risk of TCS by washing. So it is all about the prevention. Tampon, not using tampons and alternating them with sanitary napkins. If using tampons, choose ones with the lowest absorbency that will handle menstrual flow, and change the tampons often. On low flow days, you can use pads instead of tampons. So it's all about that. So I'm just marking this particular line which indicates the bracket. Any female who has had TCS should not use tampons. Clean and bandage the skin. All wounds as quickly as possible. Call your doctor if a wound gets red, swollen or tender if a fever begins. And text D, antibiotic therapy. All patients with suspected TCS receive empiric treatment with clindamycin. Adults 600 mg IV every 8 hours. Children, how much it is? 25 to 40 mg or kg. Then vancomycin. Again, a lot of medicines mentioned. Adults 30 mg, 40 mg IV. Children, okay, 4 divided doses. Typically treat with a 10 to 14 day course. So these are my keywords from these texts. Okay, most welcome. So coming to the first question. So please do let me know your answers. All right. So first one, common precautions for TCS. Already you know the instructions very clearly, but once again I'm reminding you, 1 to 7 set of question, match the following. Okay, so you can answer in A, B, C or D, and you can repeat. Repeat, if it is mentioned, you can repeat. Okay. So the first one, common precautions for TCS. So yes, my keywords, precautions. So where they have mentioned about the precautions, preventive measures. Yes, only 2 of you got the correct answer, right? Only Shiny and Celine. Divi, yes, Vineet. Okay, so answer is from text C. I agree. Okay, Monita, it is from text C, so that answer is from text C, prevention. Very clearly mentioned in this long para, what are the preventive measures for TCS syndrome or TCS. So, answer is from text C. Second one, splitting of doses in people with TCS. So, splitting doses. Yes, Monita, Kamlesh, Alina, Nayana. It is from text C. Very good. So, what about second question? Splitting of doses in people with TCS. Sorry, TSS. I'm always saying, what was that? Yeah, TCS. It's actually a name of a vehicle, I think. Yeah, so TSS. Okay. Very good. Answer is in text D. Correct answer. So already you guys secured 2 marks. All right, Shiny. Yes, Alina, Celine, Monita. It is from text D. Okay, Vineet. A small mistake, not B, D. D a lot of D. Yes, Nimmi and Naina, text D. So splitting of doses in people with TCS. You can split according to the population. Population in the sense children and adults. So adults 600 mg, then 25, it's for children. So see, the dosage is splitting among adults and children. So that is in text D. Third one, common indicators to evaluate TCS. So my keywords, indicators, evaluate. Signs are, they are asking what are the indicators, what are the signs. So where they have mentioned about the signs, okay Vineet, very good, text D. And what about third one? Yes, Shiny, very good. You're the first one, right? Yeah, okay. Okay, Celine, second. Alina, third. Okay, so answer is mentioned in text B. So you got the correct answer. And where is it mentioned in text B? The question was common indicators of TCS, and in text B, yes. Okay, diagnosis. So diagnosis of the TCS is based on these criteria. Okay, so that is in text B. Very good. Yes, Deepa. Hi, Deepa. Okay, Vineet. Third one is not C, dear. It's B. Okay, C actually they have mentioned complications as well as prevention for the complications. So indicators mention the criteria. It's in text B. Okay. Hi, Jessa. Good evening. Later. Anyway, fourth one. What can be inferred as the source of TCS? So my keywords, inferred, source. Yeah. What can be inferred as the source of TCS? What is the condition and what are the reasons which is mentioned in the text? Comment. Where is it mentioned? Yes, Shiny, Alina. Anyone else with the correct answer? Okay, Celine. Answer is mentioned in text A. Very good. It's mentioned in text A. Okay, so where is it mentioned in text A? This is the reason. See, TCS is rare but potentially life-threatening condition caused by certain strains of bacteria. Okay, that produce toxins. Fifth one, how might the body temperature of someone expected to have TCS? So my keywords, body temperature expected. A very direct answer, but paraphrased. Okay, not paraphrased, synonym is used there, I think, yeah. Body temperature of someone expected to have TCS. Where is it mentioned? So fourth one is yes, Nimi, Kamlesh, Divi, Jisa. Yes, Nayana. It's okay, dear. Yeah, so answer is A. And what about fifth one? Fifth question, yeah. Okay, Nayana, yes, it is B. Yes, Selin, Divi, Alina, Shiny, Nimmi. Yes, it's from text B. Answer is B. So where is it mentioned in text B? This is one of the factor. Fever above this much. Okay, so answer is mentioned in text B. And sixth one, the medium through which the medications are given. So medium, medications. Only two keywords. So what about that? Yes, Vineet, Deepa. Yes, it is text B. And what about question number 6? Already you guys scored 5 marks, right? And this is next one, sixth one. Okay. Very good. Answer is mentioned in text D. Yes, Deepa, Alina, Selin, Shiny. It is mentioned in text D. Medium through which the medications are given. See. So what is it? What is the medium? All patients with suspected TCS receive empiric treatment with clindamycin, and this is the measurement through IV. So answer is in text D. Then seventh one, who mostly come up against TCS? So mostly against TCS. Alright, Nayana, Deepa, Alina, Selin. Yeah, it is text D. What about Vineet? Okay, seventh one. Yes. Text A, right? Very good. It is from text A. Okay, mostly come up against TCS. So as I already mentioned, text A the prevalence is mentioned there. What is the condition? What are the cause factors? It is mentioned. So half of all cases are unrelated to menstruation. So answer is in text A. Clear? So that is the correct answer. Yes. And I know, yes, Shiny got 7 out of 7. Nimmi, Nayana, Divi, Jisa, Alina, Selin, anyone else? Deepa and Vineet. I hope you got 7 out of 7, right? Any changes? Yes. So very good. Well done. Coming to the next set of questions, 8 to 14. You can answer in a word or a short phrase. Yes. Congratulations. Okay, Jisa, Alina, Selin, Divi, Shiny. Okay. 8th one. How often should the adults have to take clindamycin per day? So what about question number 7? My keywords, how often? How often varninda? How many times? What is the frequency? Adults, clindamycin. So clindamycin is mentioned in text D. Okay, so what about this frequency of the medicine? Yeah, answer is every 8 hours. Okay, see, every 8 hours you can administer the medicine. So answer is every 8 hours. Very good, Alina, Vineet, Selin, every 8 hours. Yes. Either you can write every 8 hours like this, or you can write the figure also there. 8 and both are correct. Okay. Then, next one. Which medication? Yes, Nayana, very good, Nayana. Yes, Jissa, Shiny, very good, Shiny. Okay, Nimmi, yeah, it's every 8 hours. 9th one. Which medication would be given along with clindamycin to treat TCS? So, medicine or medication along with clindamycin to treat TCS. Yes. What is another medicine along with that? Where is the medicine use? Yes. And if you write the name of the medicine, the first letter should be capital. Okay. Actually, here it is in small letter, so that you can write the first letter in small. But majority of the time, please do check the paragraph. If the name of a medicine, if the name of a person, if the name of a disease condition, whatever, if it is a noun, the first letter should be capital. But here it is in small letter, so that you can write small letter. Okay. Otherwise, it should be capital. Yeah, so vancomycin is the answer. And if you guys are starting the first letter capital for the first question, yeah, you can follow to the rest of the questions, no problem. Okay. Clear alle? Adime thanne ningal first question ipo ivide E ennu parayunna capital aanengil, then you can Follow to the rest of the questions, capital letter. First letter should be capital V. Clostridium difficile angle C capital. So likewise, you can follow the same. But if you guys are following whatever it is mentioned in the para, then it is small letter mentioned there. So don't write capital. Yes. 10th one. The infection by which bacteria can be rare in the cases of TCS. So infection, bacteria, rare. Yes, Deepa, vancomycin. Yes, Nimmi, vancomycin. Yes, Jissa, Selin, Vineet, Shiny, Alina. Yeah, it's vancomycin. What about 10th one? The infection by which bacteria? Which bacteria is mentioned there? Bacteria, because of bacteria, this condition can occur. It is mentioned in text, right? So what is the name of the bacteria mentioned there? The bacteria, it is Clostridium 𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐃. When you write the answer, please be careful about the spelling, okay? It is SORDELLI, not one I, double I. Or I matrana editollangal, your answer is wrong. It is double I, okay? Yeah. Okay, Nayana, Shiny, Nimmi, Divi, Alina, Selin, it is Clostridium 𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐴𝐃. Then 11th one, where bacteria can grow very easily. So 2 mediums. 2 mediums in parayumba, don't write 1, do write 2. 2 medium namukku venam. What are the 2 mediums? What are the 2 mediums? Where is it mentioned? The mediums. Maybe in complications, I guess. What are the 2 mediums it can cause? Through? Yes, very good. Okay, Divi, it's heat and moisture. Okay, it is mentioned in text C, as you can see here. Between menstrual periods, store tampons away from heat and moisture where bacteria can grow very easily. So answer is heat and moisture. Very good. Okay, Vinith, it's not open wound. See, it is actually the risk factors which we had. Namukkulla risk factors aayirunnu. Pakshe ivide choichirikkunna what are the mediums aanu. Endu vadi aanu allengil endu through aanu it can cause. Appo endana? Heat and moisture is the answer. Okay, so yeah. Text C, this is the answer, heat and moisture. That is the correct answer. And next one, the prevalence of fatality rate of TCS. So, TSS. Again, I'm so sorry. Prevalence, fatality. Yeah. Prevalence of fatality rate of TSS. So, what is the prevalence rate of fatality? Which means, yeah, the severity, death condition. So, what is it? Etrana? Prevalence of the condition, which is, what is the prevalence? Death. TCS can be fatal with a mortality rate of 30 to 70%. Okay, 30-70%. That is the correct answer. Yes. Okay, 30 to 70%. Yes, Vineet, correct answer. Yes, Ellen, correct answer. Okay, Selin and Vineet, only you got the correct answer? Yes, what about others? What happened? Okay, so 13th one. The usage of which object is considered as the supermost cause of TCS? So my keywords, usage, object and cause. If you are using this, you will get the condition TSS. Yeah, which is the thing in the UCM brana. You can get this TSS. It is? Okay, Jisa, very good dear. Okay, it's tampons, right? So, tampons. A very direct answer from text A. So, I'm not reading it. It is from text A, very clearly mentioned in the first para. What kind of dizziness can be noticed in patients with TSS? A common sign of the same. Yes. What kind of dizziness? In the type of dizziness, I'm not mentioned. I think the dizziness is just mentioned here. Yeah, and that is orthostatic dizziness. So, answer is orthostatic. ORTHOSTATIC. Okay, again a direct one. Orthostatic. Yes, Divi, Alina, Very good. Yes, Nimi, the previous one is tampons. Yes, Jissa, Divi. Okay, Elena. Yeah. Okay, Vinith, you don't have to write that super absorbent tampons. You can write just tampons. Okay, your answer is correct. Okay, will be correct. Strike off but still, you can just write that thing, tampons. Okay. Yeah, orthostatic is the answer. Yes, Nimi and Shiny. Yeah. So coming to the last set of questions, 15 to 20. Fill in the blanks. Okay, again, write in a short phrase or a word. Diarrhea and vomiting are classified under dash. So under what? Diarrhea and vomiting are classified under this. And then the under it is classified under what? Diarrhea and vomiting. See, these are the signs. In the multi-system dysfunction. So answer is multi-system dysfunction. Yes, Divi, Alina, that is the correct answer, which is multi-system dysfunction. Kanda, bullet points are, and a lot of questions from bullet points. Okay. And 16th one, skin wounds dash nasal packaging, scrapes, burns or areas of injured skin can increase the risk of the condition. So what condition? What is the missing word here? It's not a short answer question, but still. Skin wounds dash. What is the missing word? Yes, very good, Vinith. It is surgical incisions. Yes, Alina, very good. Yeah, it is surgical incisions, not incision, incisions. Okay, and that answer is mentioned in text A. Skin wounds, surgical incisions. Kanda. That is the missing word. So when you do this type of questions, I mean fill in the blanks type of questions, do find out which word is missing from the sentence or which words are missing from the sentence. Okay. If article is not mentioned there, you should write the article. We will just focus on to the important word. That's the side of article miss. Okay, or the preposition we will miss. Off miss same. So whatever it is mentioned in front of or after this word, please do incorporate it or please do encompass it. Okay. Yes. And 17th one. All the anti-therapy medication have to be followed for a course of dash days. How many days? Already we know this answer. It is 10 to 14 days. Okay, Ramesh, it is surgical. It's not incision, dear. It is incisions. Kanda. This is another careless mistakes which we had. Mistake. I mean, so what is it? Surgical incision alla. Incisions are verandad. Okay. Yeah. Yes, Jissa. Jissa also. Incision alla to Jissa. Incisions. Anyway. So coming to this 17th one, 10 to 14 days. Direct answer from text D. 10 to 14 days. And 18th one, when you use a tampon, Staphylococcus aureus or staph bacteria may become trapped in your vagina and enter your uterus via your dash. Via what? It's through. Into the uterus, it is through cervix, right? No. Where is it mentioned? It's through cervix. Yes, it's mentioned in. Very good, Shani. You got the the correct answer. Yes. Yes, we need Alina. It is cervix. CERVIX. Yes, the way it is cervix, which is mentioned here in text A. Okay. So when you use a tampon, that is a complete line. It is entering through your cervix is the answer. Okay. That's it. Then, second last question. All patients with suspected TCS receive dash with clindamycin and vancomycin. So, what is it? Okay, Ramesh. Jissa, Nimmi, Selin, Nayana, Divi, Alina, Vinidya. It is cervix. What about question number 19? Question number 19. All patients with suspected TCS receive dash with clindamycin and vancomycin, which is mentioned here in text D. Yeah, that is empiric treatment. Very good. That is the correct answer. which is mentioned here in text D. A very direct answer. Alle? What about the last question, 20? Yes, Ramesh, Vineet, Nimmi, Selin, Shiny, Alina, Divi. And what about question number 20? Replacement of tampons with dash or pads during menstruation can have an effective way to prevent TSS. So what is it? What is it? Replacement of tampons with what? എന്തായിരുന്നു റീപ്ലേസ് ചെയ്യണമെന്ന് പറഞ്ഞത്? Do you guys remember that? Very good. In text C, the prevention method is mentioned. So you can replace tampons instead of tampons, you can take what? എന്താണ് എടുക്കുന്നത്? Sanitary napkins. Very good. And that answer is mentioned in text C. അല്ലേ? Yeah. So it is mentioned here in text C. You can use sanitary napkins. That is the correct answer. So anyone with 20 out of 20? I think today you guys are very happy because such an easy material and you will get 20 out of 20, and I'll pray for you guys because exam material kitate namukku prarthikam alle. Anyway, yeah, 19. Which question was wrong, dear? Shiny? Induati? Yes, Alina? Excellent, very good. Yes, Selin, 20 out of 20. Very good. Yes, Divi, 20 out of 20. Anyone else with 20 out of 20? I'm so curious. No. Anyway, so that's that. Okay, so let's see on Monday. So happy weekend. Take care. Thank you.